I'm Barbara Barry. Several years ago, when I was diagnosed with colorectal cancer, I experienced more intense emotions in real life than I ever imagined I would as an actress. But then I learned that my cancer was treatable, that I could pick up where I left off. I knew I'd have to fight, but I knew I would survive. And then there's that word, ostomy, that word. I didn't see how I was going to manage, from day to day. But with the help of my friends and my family, and especially my ET nurse, here I am. I won't kid you, it's not going to be easy. But as you heal, you'll find that there are products and other options to fit your lifestyle, and you'll find the one that's best for you. F. Scott Fitzgerald said that there are no second acts in American lives. But I'm here to tell you that so far, I'm having a great second act. And I'm sure you will too. I'll see you later in the program.
Hello. I'm a healthcare specialist who works with ostomy patients every day. Now that your surgery is completed and you've returned home, I will help to prepare you for a smooth transition to a daily routine using the Convatec SureFit ostomy system. During the next few minutes, we will demonstrate the techniques to help you understand the procedures you need to follow during the removal and application of your ostomy products, and to help you feel more comfortable and confident as you establish a routine that works best for you. Your healthcare professional has chosen the SureFit autolock system for you. The system is easy to use and provides the security and personal comfort that you will need in an ostomy system. Here's our ostomy patient. She will demonstrate the proper technique for removing and applying the SureFit autolock system. First, assemble the supplies you will need: a flexible wafer, a stoma measuring guide, your pouch, a duolock tail closure if yours is a drainable pouch, stoma adhesive paste, a pencil, curved scissors, and a moist washcloth. Before you change your ostomy system, you should always wash your hands. Next, remove the system you are wearing by gently pressing on the surrounding skin and peeling off the wafer. Then wash the skin thoroughly with a mild oil-free soap and pat dry. Remember that any oily substance will cause poor adhesion of the wafer. Now, measure the widest part of your stoma using the stoma measuring guide. Select the opening that most closely fits around your stoma. It is important to do this regularly since your stoma size will shrink during the first year after surgery. Next, it is important to select a wafer with a flange opening that is at least 1/2 inch larger than the widest part of your stoma. Our patient's stoma is 1 1/4 inch, so she has selected a 1 3/4 inch flange. Make sure that the tab on the flange is in the 12 o'clock position, as you see here. Trace the stoma outline that you have measured onto the back of the wafer release paper. Using a pair of curved scissors, enlarge the hole to match the outline size you have drawn. If your healthcare professional has recommended the use of a disposable convex insert with your flexible wafer to improve skin contact or extend wearing time, insertion into the flange is a simple 3-step process. Choose an insert with an inside width at least 1/4 inch larger than the widest part of your stoma. It may be necessary to stretch the wafer to accommodate the insert. Simply press your thumbs inside the flange to stretch the adhesive and break the release paper. Press the convex insert firmly into the flange. You will hear several snaps as it fastens into place. Next, remove the release paper from the barrier as you see here, but leave the remaining release paper on the side edges of the wafer. Apply a ring of stoma adhesive paste on the back of the wafer around the opening. Wait 1 minute before applying the wafer. Do not spread the paste. Now, holding the wafer over your stoma, smooth it down gently as it adheres to the skin. Finally, remove the remaining release paper from the border tape and finish smoothing the adhesive onto the skin surface. Now you're ready to apply the autolock pouch. First, make sure the pouch has a small amount of air in it. If you are using a drainable pouch, apply your duolock tail closure. Simply fold the end of the pouch over once, slide the tail closure over the fold, and snap closed. Then, line up the outer lip of the autolock pouch flange over the lip of the wafer flange at the 12 o'clock position, moving your fingers down toward the 6 o'clock position until you hear the pouch lock into place. Surefit autolock urostomy pouches feature the AccuSeal tap, which securely closes the pouch while you are wearing it and allows easy draining. Simply twist the swivel valve so that the red dot faces away from your body. This indicates that the tap is open, as you see here. The tap can also be attached to a nighttime drainage system if you wish. Once the pouch is locked into place and you have worn it for a short period of time, the autolock pouch can be rotated on the wafer without taking it off. This allows for convenient emptying or repositioning of the pouch for greater comfort under clothing, or when you're sitting or lying down to rest, or at bedtime. To remove any autolock pouch from the wafer, simply slide the tab on the top of the wafer to the right or left. This releases the locking mechanism, permitting easy removal of the pouch from the wafer, or the release of gas, which you can do by burping the pouch, as you see here. Whenever you release the pouch, be sure to use one hand to secure the pouch while you detach it from the wafer with the other hand. Once you learn these procedures, managing your ostomy will become part of your daily routine, and you'll find that you'll be able to pursue activities that you've always enjoyed. We also realize that you'll have some important adjustments to make, and you'll have questions about your ostomy and how to care for it properly.
Well, that's it for the demonstration. With time, you'll find yourself easing back into normal activities. But if you have any concerns or experiencing any difficulties, please call your healthcare professional or your doctor immediately. I did many times. And please take advantage of the wonderful resource guide appearing next.
The following is a listing of electronic bulletin boards called newsgroups available on the Internet. These newsgroups provide online peer-to-peer support to ostomy patients and their families. For information on newsgroup access, please contact your Internet service provider. Convatec does not support or endorse the advice or content contained in any newsgroup or worldwide website not directly managed by Convatec or its parent company. These newsgroups are listed for informational purposes only.